Next, inspecting the patient. So inspection of a patient starts from the front, starts from the side, the back, and functional observation. So what are the things that you need to look when you're going to look from the front, from the side, from the back, and on function observation? The first thing that you need to look in inspection is to know what is normal. So to know what is normal, the normal contours that are seen in a patient with an extended knee is to first see for the patella. To first see whether the patella is taut, or to see whether the patella is first of all visualized. If it's visualized, look for the parapatellar recess or the parapatellar hollow. Recesses tell you whether the joint is dry or if the joint is full. Once you see the recesses, see for the suprapatellar region and see for the infrapatellar region. All these are observations from the front. So you look for the parapatellar regions, you look for the suprapatellar regions. Once you see this, in case there is a loss of the normal contour, specify and tell that there is a loss in the normal parapatellar recess, which inadvertently tells that there is some pathology inside the joint which has caused the fullness. Most often, if the patient is going to be fat, even in those cases there will still be a recess, but if there is going to be a fullness, it's well observed, or in case of synovitis, it's well observed that the recess is not going to be seen. The other part that you need to see are scars, which tell you any telltale signs of trauma, or tell you any previous surgeries that have been done, or any open injury that has occurred. A swelling, most often which you see is going to be in the popliteal region. You need to know whether it is, at which region is it, either it is going to be in central or in the eccentric part. Next, look for any sinuses, discharging sinuses in case of any surgery which has occurred due to infection or due to a trauma wherein they have done a surgical intervention. In case it's going to be a swelling which is in the posteromedial aspect of the leg, which is widened, there's stretching of the skin and there's engorged veins, you need to look or think in terms of a tumorous condition. And again, reconfirm what you saw in attitude of any deformity that is present. So whenever you're going to inspect, this is the thought you need to have in mind. You need to have a pictorial representation of how the limb is going to look if the patient is going to be muscular, or even if he is not going to be muscular, imagine how the normal contour or the muscles are. So this is what I meant by the parapatellar recess. This being the suprapatellar region, these being the parapatellar recess, and these being the infrapatellar hollows that you see. So in case of any effusion, all of these will not be present, as in there will be a fullness. So once you observe this, the things that you need to know are the muscles which are going to be on the top, which starts off with your vastus medialis to the quadriceps. You come to the patella. You think of what is there inside the patella, being the joint line, being the MCL, being the patellar tendon, looking for the tibial tuberosity, looking for the pes anserin region, the tibialis anterior, the Gerdy's tubercle, the biceps, the fibular head. So this can be confirmed by also thinking of what is there posteriorly also. By looking at the popliteal space, you will know that it is a diamond shaped space which is marked up by the hamstring muscles and down by the gastrosoleus, which comes and the gastrocnemius, the medial and lateral gastrocnemius, which make the borders of your popliteal fossa, wherein the popliteal vein and artery run inferior. So these are the muscles which we had already spoken about. So this tells you where the issue is and what can be going wrong for the patient. So from the front, again, what you need to see is for this hollow, you need to see for this suprapatellar, you need to see if there is any tightness. Okay. So again imagination and again finding out or thinking of what can be seen. So the ideal things that can be seen are for any vastus medialis obliquus wasting, or you can see for any swelling which is going to be present, like in case of synovitis, a complete fullness of the suprapatellar region, or in case of a prepatellar bursa, the whole patella being swollen. So in this case, you can again see a patient with the knee joint. You can see both the medial condyles touching each other and the leg slightly going into valgus. Whereas you can see from the image from the top and down, you can observe that here between the right and the left leg, you can see the whole patella being larger or wider, giving a thought process of it being an inflammatory condition, can be a condition due to a patella magna, which can be due to, very rarely due to a degenerative pathology, but can occur due to any other cause. Here you can see the fullness which we have been speaking about. Here you can see that there is a huge hollow, whereas here you can see the complete fullness, not only in the medial parapatellar recess, but also in the suprapatellar region. Again, a case of prepatellar bursa. You can see that all these are just by an examination of the patient by looking in the front with the knees extended and as parallel to each other as possible. The next, by flexing the knee joint and looking from the side to see whether the tibial tuberosity is elevated or more prominent in case of like a Osgood-Schlatter disease.